This PowerPoint focuses on foster care children and some of the health concerns that they face. The population of foster care children and their increased risk of health disparities is the main focus of this PowerPoint. When it comes to foster care children, physical and mental health problems are significantly more common among children placed in foster care compared with children living in an array of household arrangements. This could be because of multiple reasons. Foster care children can have a disadvantage due to maltreatment, or even risk associated with placement such as poverty, parental drug and alcohol abuse, neighborhood disadvantage, and epigenetics. It is known that all of this causes this population to have increased depression, anxiety, ADHD, and behavioral problems. When it comes to the population sizes of foster care children, the main focus was getting data for those in foster care that were under the age of 5. Locally, in the Salt Lake County, there are 630 foster care children, but this number was not broken up to ages, meaning we couldn't get any data under the age of 5. Statewide in Utah, there are 2,704 foster care children, with 676 being under the age of 5. Nationally, there are 427,901 foster care children, with 141,207 being under the age of 5. And internationally, there's roughly 2 million foster care children. This number can only be an estimate because it is believed that this number is significantly higher because this data is only coming from registered institutions. This number was also not broken down by age. The population size per capita of foster care children in Utah is smaller than the population size per capita nationally. A couple factors that could cause this number to be smaller is the environment. Environments differ from state to state, and environments can play a huge role in how people act as well as what children are exposed to. Another factor that could affect the numbers could be the population size of Utah. Utah is not a large state. We don't have a large population size, but states with larger populations could in return have more foster care children that need homes. When it comes to foster children, they do have social determinants that affect their health. One of the main social determinants that foster care children face is access to healthcare services. Medicaid does offer coverage to some children and youth in foster care, but they must meet certain requirements to obtain this coverage. Other types of coverage that may be available are CHIP, or Children's Health Insurance Program, or private and marketplace healthcare coverage. These two are harder to meet the requirements, but some foster children are eligible. When it comes to foster children, challenges arise when it comes to identifying who is eligible, communicating the change benefits to them, and ensuring that they receive optimal health care. All of these are even more of a challenge in the younger population of foster care children. Another challenge that comes up that is a social determinant is transportation options. Even for those children who meet the requirements for health care coverage, this does not mean that they always have a way to seek care. It is also easier for the older population to make their way around to find care, but for the younger population, they have no idea where to even start to look for transportation. A couple other social determinants that affect this population come from their environment and the people around them. These are the following: socioeconomic conditions such as living in poverty, not having access to community-based resources based on where they end up living, and the concerns of public safety depending on the environment. Some children end up not being safe in their environment, and some end up being in an environment where they're exposed to crimes, violence, or drug and alcohol use. All of these social determinants can affect the health of these children, and they need to be addressed in order to improve their lives and allow them to have the least amount of health disparities as possible. There are many different concerns that can affect foster care children, first being psychosocial issues that are related to family function. Studies have shown children in foster care have high rates of mental health problems, unemployment, homelessness, low educational attainment, and PTSD. Another concern is abuse and neglect. This can lead to physical injuries, low self-esteem, attention disorders, brain damage, and violent behaviors can be seen in these people. Education is also a major concern. Studies have shown that foster care children are the lowest performing, with the lowest number that earn a college degree. These children are also more likely to be held back, and they continue to lag compared to their peers. As far as social issues go, these children have poorer physical health with higher number of teen pregnancies, more marriages to spouses who fail to provide emotional support, and greater social isolation. Financial issues can also arise with foster care children. The majority of foster care children end up being self-supporting, and this combined with lack of education can cause financial issues in life. It is shown in studies that those children who were in family homes actually do better than those that were in group settings. When it comes to the root cause of why foster care children are at increased risk of health disparity, the number one cause is from lack of support. These children do not have the support that they need in order to survive. Foster care children can end up not having support when it comes to having a safe environment, safe food or water, or even safe relationships. All of these can play a major role in health disparities and can lead to a foster care child from not surviving or just barely surviving. Without support, how are these children supposed to know that they have a purpose in life and that they deserve the best shot in life as all other children get? Another root cause that can play effect on foster care treatment is maltreatment. Maltreatment is based on the support that the child gets as well. If a child gets placed in a home, their risk of being abused or neglected are higher than other children. This causes the child not to be safe and not to get the care when medical care is needed. When it comes to Maslow's hierarchy of needs, the only level that is generally met with foster care children is the physiological needs, meaning that they have oxygen, food, water, and a constant body temperature. As for the unmet levels, the first is safety. Most of these children lack safety in their lives, their environment, their health, and their resources and support. The next level unmet is love and belonging. These children do not feel love and belonging. Instead, they feel rejected and out of place. They often do not have relationships that last with families due to constant placement in different homes. Next, the esteem level is not met in foster care children. One of the major concerns that leads to their behavior problems is lack of confidence and self-esteem. They often bring themselves down rather than having achievement in their lives. And lastly, self-actualization. Foster care children do not realize their true potential or what they are worth. They go through too many traumatizing events that this level does not come easy to them. It is hard for them to seek self-growth. With all of this having an effect on foster care children, their anticipating functional level is bare minimum at the physiological needs. Health outcomes are often poorer. In foster care children who are at the base level, this level is the person who has simple needs only. Engagement with healthcare aims to ensure functional adequacy and a good quality of life are met. They are not concerned with healthy numbers or long-term outcomes. Instead, they are focused on symptomatic well-being. Overall, foster care children are at an increased risk for communicable diseases. This is because a lot of communicable diseases are environmentally induced. Two of the biggest risk factors that are associated with this increased risk are the following. First, underweight. Especially in those under the age of 5, nutritional deficiency plays a major role. Underweight children are more vulnerable to more frequent and severe infectious illnesses. In fact, death due to lower respiratory infections, specifically pneumonia, has been the first or second ranked disease among all infectious diseases in foster care children. The next risk factor is sanitation. It has been found that inadequate access to sanitation, hygiene, and safe drinking water increases the likelihood that foster care children deal with diarrheal diseases. Unfortunately, these risk factors take place before children enter foster care. However, we can monitor them for these diseases and treat promptly when they are noticed. A couple things that we can do are the following. The children need to have a thorough physical assessment upon entering foster care. If there are any urgent medical needs, they need to be taken to the emergency department. These children need to be reassessed within 1 month, and they also need to undergo vision, hearing, and developmental examinations. Along with the first initial assessment, children need to have more frequent medical visits, preferably every 3 months, to evaluate the child's ongoing needs and to make sure they are in a suitable environment. Non-communicable diseases are those that cannot be transferred from one person to another. Studies have shown that foster care children do tend to develop these diseases more often than other children. The reason for this is because of some of the risk factors that foster care children can encounter. These risk factors can be, but they're not limited to, the following: genetics, age that they become a foster care child, exposure to air pollution, their environment, or even behaviors such as lack of physical activity or a poor diet. Some non-communicable diseases can also be hereditary, and especially in some other countries, hereditary diseases are seen often in foster care children. Some of the diseases seen in foster care children are lung cancer, hypertension, chronic respiratory diseases, and cardiovascular disease. Preventing these are difficult in foster care children because the children enter foster care at various different ages, and what happens to the children before this time is hard to fix. What foster care can do is to help manage these diseases when the child is in foster care. Managing them includes providing support to the children, allowing them and helping them to seek medical care, and even help fix some of the behaviors that can help minimize their risks, such as their diet or exercise. Foster care Okay. Foster care children are at a risk for self-care deficits. One of the main reasons for self-care deficits is the act of not caring in these children, as well as the lack of access. Some foster care children start to not care about their personal well-being, and this can be because of depression, trauma, or even abuse or neglect. Lack of access also comes into play. Some foster care children are placed in homes that do not allow these children access to what they deserve, for example, a simple toothbrush. Some children are deprived while being in homes. In order to help fix this problem, foster care families must be closely monitored and interviewed before they are able to place a child in their home. Also, underlying issues about the child not caring about themselves must be addressed and fixed as well. As terrifying as it sounds, it is actually quite common for foster care children to harm themselves. It is said that this is from their traumatizing events that lead up to this. Some self-harm behaviors that are seen in foster care children are scratching, bruising, burning, or cutting themselves, and it is known as a way of coping, not a suicide attempt. These children may be bullied, struggle to cope with the separation, grieving, or even feeling rejected or lonely. One of the best ways to prevent this is to help foster care children find new ways to cope, help them build their confidence, provide support, and help and make sure they are getting the proper care that they need. When it comes to foster care children being harmed by others, studies have shown that they are at an increased risk. In fact, surveys show that as high as 40% of former foster care children report having been abused or neglected when they were in care. When it comes to the younger population, it is hard to get an accurate number on how many are abused during their time as a foster child. The reason for this is because some of them cannot communicate, some are taught not to speak up, and some may be afraid to speak up. With this being said, it is thought that harm to foster care children is a much greater problem than statistics would suggest. Unfortunately, there is only so much we can do to prevent this from happening. One of the biggest things that can be done is choosing foster care families. A couple things that can be done to choose these families are the following: a more in-depth screening before they receive their license, reducing risk factors, such as knowing the foster care family's employment situation, stressors, or even family history, and strengthening protective factors that keep children safe. As far as causing harm to others, it is known that foster care children can end up causing harm to others. Foster care children go through traumatic situations. They are first separated from their primary attachment, which affects children differently depending on their age. Most go through some sort of abuse in their life. They go back and forth between families, and much more. It is a fact that foster children are 6 times more likely than other children to have behavioral problems that can be caused from all of these experiences that they encounter. All of these issues can lead to foster care children being very uncooperative, physically aggressive, and struggle with impulse control. Helping these situations can be very difficult. The best thing that these children need are a safe therapeutic environment with support. A therapeutic environment can consist of staying calm, using positive rewards for desired behavior, no physical punishment or negative measures, being understanding, set clear rules and expectations, and follow through. It can take a while to help these behaviors, but if we start at the beginning of these children's foster care experience, the better outcome that they will achieve. Here are the references used for this PowerPoint. Thank you so much for watching.